The largest solid organ is the liver, located under the rib cage in the right-hand portion of the abdominal cavity. It performs various life-supporting functions, maybe more than 500 in your body, including maintenance of your blood sugar and removing toxins from the body. The liver produces bile, which aids in digestion. Fatty liver disease is a medical condition that occurs due to the accumulation of extra fat in the liver. Steatohepatitis is a stage in the fatty liver that occurs due to inflammation in the liver in addition to excess fat. The primary reason for fatty liver includes overuse of alcohol, obesity, high cholesterol, or poor living habits. Usually it does not create a problem, but sometimes it becomes dangerous for your health when fat reaches 5% to 10% of your liver's weight, leading to liver damage. Some warning signs may indicate a fatty liver and help you combat the illness as soon as possible. Number 1. Chronic fatigue or tiredness. Fatigue is not specifically associated with fatty liver, as it may indicate a laborious day or hard work, but the feeling of extreme tiredness and exhaustion can be a warning sign among other health conditions. You must consult a physician if extremely tiredness happens upon waking up, and the frequent occurrence of this symptom may symbolize poor liver health. Number 2. Pale skin and eyes. The color of your skin and eyes changes if there is some problem with your liver. The fatty liver turns your skin and eyes darker and pale. It may also cause acute itchiness on your skin. Number 3. Spider web-like cluster of veins. A warning sign in fatty liver is when a cluster of small spider-shaped arteries appear under the skin. These are common and completely okay if present in healthier women. On the contrary, when they appear more prominently, like a spider's leg as red dot with blood vessels emerging out from the center on the upper half of the body in men or women, they may suggest liver disease. Number 4. Bruising easily or bleeding. Utilizing vitamin K, the liver produces proteins essential in blood clotting. In case of liver damage or fatty liver, it will not efficiently clot as before. When you have unexplained instant bruising accompanied by bleeding elsewhere, it can be a warning sign of fatty liver. Number 5. Darker urine. Urine appears umber-colored, dark brown, or orange in the case of fatty liver. The change of color occurs due to excess bilirubin building up, which the liver is unable to break down. Swollen abdomen ascites happens because fluid is retained in the abdomen. Number 6. Weight loss. You may notice a significant weight loss without any change in diet or daily activity. It can be alarming, and you must go to an ultrasound or a blood test, including liver function tests. Number 7. Loss of appetite. Fatty liver also leads to a loss of appetite. It may also be the reason for sudden weight loss. Number 8. Pain or discomfort in the upper right abdomen. As mentioned above, the liver is situated on the upper right side of the abdomen. The liver damage may result in swelling in the abdomen due to fluid accumulation, also known as ascites. Pain or discomfort at this point can be a warning sign of fatty liver. It may also lead to swelling in the legs called edema. Number 9. Nausea. The liver helps filter out the toxins from the body. The fatty liver becomes unable to do its job of clearing toxins that may result in toxin buildup in the bloodstream, leading to nausea. If you liked and enjoyed this video, give this video a thumbs up and subscribe to our YouTube channel for more updates like this.